Okay, Jennifer, so this is ankle mobilization. So as you can see in the video, you're basically just trying to get your foot as flat as you can, and then we're just going to roll through all the dorsal or the top aspect there. And notice here that you have the toes curled under a little bit, and that's what we want. We want to be able to roll from the big toe all the way to the little toe. And then you can change your angle of your lunge. So you'll be able to see here in the video in a second where you step forward a little bit, and we'll use that to change the angle of the force that's going into your ankle joint. So wrist mobilizations, we just want to make sure that we go nice and slow. And you'll see in the video that thumb's kind of sticking out. Eventually we would like to wrap that thumb all the way around and make a complete fist. Eventually we'll work our way to doing both arms at the same time. And I know it's a little painful at first, but it'll get better quickly. Child's pose, so this is for the low back and especially for the toes. So we want to make sure, as you can see in the video, you got a couple of the toes sticking out there, so we want to try to get all the toes wrapped up underneath. If you don't get them all underneath, that's okay, but we want to make sure that the big toe or that first metatarsal is constantly getting stretched, and then we'll roll the heels somewhere in between those 2 points. Right there is really good, and you should just feel a nice stretch all the way around the bottom of your foot and into your low back. The seated wall posture trainer, so you want to make sure that you've got your back all the way against the wall. You'll slightly tuck the chin, and then you'll pull your ankles back towards your face, trying not to use the toe extensors a whole lot. So it's not just that you're pulling your toes back, but you're pulling from the ankle joint. You should feel a big stretch in your calves and a really strong contraction in your quads. It's almost like you're trying to lock your knee a little bit. And here you'll just see the adjustment we're trying to make and get you internally rotate a little bit so that you're not just pulling the pinky toe, but again the whole foot is going to pull back. So here you'll see as you pull back, you tend to roll your ankles out a little bit. So you see where they kick out, and we want to try to keep those a little more aligned so that the second toe is in line with the knee. Next one is thoracic spine mobilization. So this is on a 4-inch roller, and we're going to start at about the breast line, so about T5, T6, and you'll go 2 to 3 breaths on each one, extending back as far as you can. You'll keep your chin tucked the whole time, tongue at the roof of the mouth, and you want to open the elbows up as far as you can. The goal is eventually to keep the low back relatively flat and keep the elbows all the way open. So you'll see here your low back's arching a little bit. We'll try to pelvic tilt and take some of that arch off the low back, but overall that looks pretty good. So the seated toe coordinator, first thing you want to make sure of is that your patella, so your knee, and your second toe are in a line. So remember when we did the exercise, you'd have a tendency to roll your whole knee in. So you want to make sure that you hold on to your knee, or at least make sure you keep it in line. And here in the video you can see where the 5th metatarsal came up, that pinky toe. So we want to keep the bone of both the first toe and the 5th toe on the ground, even though we're lifting up the phalange. Alright, so the metatarsals are kind of at the base of the toes. Those all stay on the ground, and then we work on picking up the toes, both the big toe and the pinky toe, in an alternating fashion. And again, you'll see as you lift that big toe, it tends to abduct, it tends to come across your body, and so we need to use your hand, as you have in the video here, just to open it up a little bit and get you used to that motion. So marionette, we're going to lay on the roller head at one end, butt at the other end. Ideally, we'll have both hands starting parallel to the shoulders, and we'll move the shoulder and the hip back at the same time. So it's ipsilateral, or same side hip and shoulder flexion. As you can see in the video, if you struggle a little bit, you just put one hand on the ground to help stabilize. But the goal is eventually to have both hands off the ground and move in an alternating fashion. And cross crawl is the same premise as marionette. We're just going to come across midline of the body, so this is to help stimulate the corpus callosum in the center of the brain. And it's the same thing, and the more you practice, the better you'll get at it. And remember, a lot of it comes from a weakness on that right inner thigh. So the stronger we can get the inside of your right inner thigh and that right big toe, the easier all these movements will become for you. Seated shoulder mobility, so again we get ourselves flat against the wall, the entire glutes, entire back, and the back of the head touch the wall. You just lightly squeeze a little ball between your knees, and then you just kind of do like you're washing the wall. You just glide your arms up and down. Make sure you keep your wrists flexed, and you should feel a lot of this between your shoulder blades and in the back of your shoulder. And lastly is lying diaphragmatic breathing. So the goal is just to kind of let the body be still. As we take a big inhale, it comes in through the belly for the first 2/3 of the breath, and then the chest raises for the final third of the breath. Having one hand on your belly and one hand on your chest will help you just kind of feel where the breath is coming from. But the goal is to fill up the entire pelvic diaphragm, then the abdominal diaphragm, then finally the chest. And you try to inhale through the nose, exhale through your nose or your mouth.